Morning, everybody. Thank you for being here. So it's my pleasure to speak to you today about how to adapt to the pre-transplant phase for individuals who have end-stage renal disease, maybe on dialysis, while they're waiting and looking forward to the opportunity to get a kidney transplant. So I come to you from Rush University Medical Center, and I'm going to leave lots of time for questions and answers because I think a lot of questions are going to be spawned by our discussion today. So first thing, I just want to disclose that I have no conflicts to disclose to you. And also, just an important point is that whatever we talk about here today is meant for educational purposes only. It's not meant to be taken as medical advice. All the objectives have to do with education of some kind. So first, we're going to talk about the common mental health conditions that are associated with advanced or end-stage renal disease. Then we're going to talk about coping to life and how to adapt to a life with renal disease or even when being on dialysis. And thirdly, we're going to talk about what are the qualities in general of an excellent transplant candidate so that it's an opportunity for people to prepare themselves to be an excellent candidate for a renal transplant. So first we'll talk about major depression. So major depression is one of the most commonly occurring or co-occurring conditions in individuals with advanced renal disease or who have end-stage renal disease and who are on dialysis. And it's important to realize that depression is not sadness. So I'll say it again because I think it's so important. Depression is not sadness. There's a distinction between depression and the idea of feeling sad. But I think oftentimes when we're communicating with our friends, with our families, we say, I'm depressed about this, I'm depressed about that. Oftentimes we mean to convey sadness, which is different from a major depressive episode or a major depressive disorder. So what are some of the difference? So when you feel sad about something, it affects you, maybe your mood is not as good, you may get tearful about it, but it doesn't result in a major loss of motivation. Sadness is not a total loss or a near total loss of pleasure. It does not result in a sustained social withdrawal, so withdrawing from your family, withdrawing from your friends, withdrawing from your hobbies, if you're active, withdrawing from the sports or your other social activities. And sadness it's a little bit dipped down, you come back up, especially if something else happens, you get a letter from somebody as opposed to a bill in the mail. So when something good happens, it tends to kind of bring you back up, and you tend to stay there until something else may cause you to take a dip. So I talked about this idea that it's often associated, that kidney disease is often associated with major depression, and they often occur at the same time. And part of the challenge is that there can be an overlap of symptoms. So things like fatigue, which is exceptionally common as kidney disease advances, and also I hear from patients a lot that on their dialysis days, after their dialysis, they feel totally wiped out, they really can't do much, they have to go home, they have to rest, or they may feel fatigued until the next day. That's not depression, that has to do with the biological consequences of kidney disease and also the functioning of the dialysis and how the dialysis is impacting the body. So how prevalent is major depression in chronic kidney disease? So stage 5D means it's the end stage that the person's on dialysis. That's what the D is for. So depending on whether you use structured clinical interviews or whether it's a self-report or whether it's a clinician delivering a survey to a patient, I'll just put this up there so that you can take a look. So you can see that the prevalences are pretty high, okay? And so we have to be attentive to that. We have to think that if it's around 20%, that's 1 in 5. 25% is 1 in 4. 39% even higher, and so forth. So it's important that we pay attention to it, and I think that's important that both families and patients realize that if someone's kind of behavioral pattern is totally changed, that's something to start thinking about. The person is, if you don't feel like the person you used to be, mentally and emotionally, and it's drastically different, maybe that's something to think about. Maybe something else is going on. So The key point is that mental health problems cause individuals not to take care of themselves as good as they otherwise would, or, putting it a different way, that individuals who are dealing with a mental health problem are not able to do as good as they want to. I think if you ask most people, they want to take care of themselves. They want to have the best outcome. They want to keep that kidney transplant as long as they can. They want to have more energy. They want to get back to the life that they were leading and the aspects of the life that they were lost. But things such as depression just steal that away from the person. So, how does that correlate, and why is it important in terms of the post-kidney transplant phase? I want to make this connection between adapting to life with renal disease and being while on dialysis, and I also want to intimately connect it to thinking about life after kidney transplant, because I think the two are very, very deeply connected. So, even in the pre-transplant phase, there's more missed appointments. Medication is often missed, some often forgotten. Maybe the medication makes the person feel not too well. If they're suffering from a major depressive episode, they're already not feeling well. Major depression is associated with a number of physical symptoms. It can heighten the side effect. It can make the burden of side effects more or intolerable. There may be more dietary indiscretions. Individuals who are on dialysis know that they're instructed to avoid certain foods, especially high potassium foods, because of the risks involved with that. So there can be pretty important and far-reaching effects. Okay, so the idea is the studies have shown, not just in kidney disease, but in general for other medical conditions too, an untreated or undiagnosed depression is associated with worse outcomes. And so part of my work and my job at Rush University Medical Center in assessing patients and candidates is to see if such a condition is present and to help the patient work through that with the help of their family, with the help of other supports, with the help of their other physicians, so that they can actually realize a better outcome and a better quality of life while they're awaiting kidney transplantation. Anxiety disorders are also very common. So anxiety is an excessive or difficult to control worry. It can be about one subject, it could be about their health or their future, or it could be about everything. Everyone probably knows somebody who worries about everything, or you can see that they're worrying too much. You're like, just calm down, take it one day at a time, breathe, just think about something else. We all know at least one person like that. So, but this can also be very, very debilitating. And in this case, kidney disease is a serious condition. We're not talking about a non-serious condition. It's a serious condition, and it's associated with earlier mortality. So it's understandable that a person is, going to be, to some degree, focused on that. Substance use, that's also very common. I think everyone's heard about the opioid epidemic or narcotic use epidemic in the United States. The United States uses about 97% of the entire global supply or quantity of narcotics, just to put it in perspective. So cannabis use is also on the rise, especially as different states legalize it, not only just medically, but also for recreational use. So cannabis is going to be on the rise, cannabis use. Cannabis use can mimic a number of mental health disorders, such it can cause anxiety, it can cause depression. A lot of people like to use cannabis because it actually eliminates the bad feeling that is associated with being in a state of depression or the bad feelings in a state of being anxious, and they use it. Essentially, it numbs it out, but in retrospect, it makes them actually feel better. But at the same time, it does other things. So it may sap their motivation. Cannabis off the street may actually be infected with a fungus, and if you're in a post-transplant phase and you have immunosuppressants and you're using cannabis that has fungus in it, you're in trouble. So this just gives you a flavor of the things that happen. So let's talk about adapting to life while on with renal disease or while on dialysis. So structure, I think I'm talking too loud. That's what I think. Hang on, let me just put this a little bit lower. Am I fine? Oh, I have competition. Oh, speak louder. Okay. So let's start off with structure. Structure is one of the first things to go even before somebody gets on dialysis, and that is because fatigue often ends up decreasing the person's for lack of a better term, exercise tolerance or their energy gets zapped much earlier in the day and far more quickly. That may not allow them to persist in their work, especially if they're doing a job that requires manual labor or physical vigor. So then what happens? Well, maybe they have to have reduced hours at work. Maybe work is not going to allow them to have reduced hours, or they say, look, you're no longer fit to do this job at work and we don't have another spot for you, so there goes your job. There goes the main source of structure. There goes your income. There goes your health insurance potentially. So you can see that there's a total loss of structure that's often associated with major social problems. And so now this leaves the person, they have a serious medical condition, they're trying to do their best, but they're tired. Society is not always so forgiving. And so now there's a total loss of structure. They may end up at home, and that sets things up actually to not go well. Structure is what helps us get up out of bed in the morning. We have a responsibility, we have a duty that helps us get out of bed. A sudden loss of that and the emotional distress associated with the loss of those things that created the structure for you can be pretty devastating. Oftentimes that's a lead-in actually to a depressed mood and then maybe to a major depressive episode. So the idea is, this is all to say that working to regain and reacquire some degree of structure that respects where the person is in their health is critical. The structure is critical. Everybody wants to feel that they are useful, that they are productive, that they are going after their goals, that they are realizing some sort of goals, and to have that taken away is very, very painful. And so one of the challenges is to regain that structure and to think about what are the things that I can do, what are my interests, what are the things that I can still do, and how am I going to be able to do some of those things in a way so that I can take care of myself. If I have to go to dialysis, obviously that's critical. I can't miss. That's what's keeping me alive. So, and work towards that. We've got to work towards that in a way that with compassion to oneself, but also with having some sense of, to create goals. Social engagement, loss of social engagement is also very poor, meaning that it has a tremendous effect, negative effect on people. And diet and exercise, I think, is often underestimated to the extent that it can actually help people feel better and do better. Very, very important. That's a discussion you should always have with your physician, with your nephrologist, about diet and exercise. What's the exercise can you do? What's safe? What you really should not eat? And sometimes people's bodies react differently. You may have to, experiment with certain things to find out what's going to work for you. So if you think about all these things are typically lost as the kidney disease progresses, as the person's physicality or physical condition is not as robust, and we need to think about, well, how are you going to regain these things? Some degree of structure. Think about goals. What do you want to accomplish? You can still accomplish things while you're on dialysis. I think oftentimes there's polarized thinking. Either I can do it or I can't do it at all. And this whole middle zone is totally just not used about, not thought out, and the proverbial baby's thrown out with the bathwater. And that also, I think, causes people further suffering. What do transplant programs look for? So there's two of them. There's other things, but we're going to start with those two. I think that's important. So transplant programs want to build a honest and consistent relationship with their patients. And I'm sure that patients want to have an open, honest, and strong relationship with their healthcare providers, whether it's a nephrologist or going through workup through a transplant program. So I think, and the reason why I put those two up first, because I think it's two of the most common bi-directional attributes between patients and their providers. Patients want to be open, they want to get the best help they can. They want to feel better. They want the opportunities to get the medical care, the medical treatments, so that they feel better. Providers want to provide that to patients. They want to help patients realize that, a better quality of life. Not only in the post-transplant phase, because we don't have direct control over that, but while they're awaiting transplant. That portion of life is still meaningful. And I think that that's sometimes also becomes diminished as when a person is waiting, is that my life's going to start when I get a kidney. That's throwing out all the life that's there before you get the kidney. And I think that that's really important to think about. Consistency is exceptionally important. So consistency in general is required actually to maintain a good state of health, whether you're healthy right now or if you have some condition that requires maintenance. Transplant, think about it, is a lifelong condition, but one which helps patients realize a long-term goal, right? So now you're a transplant recipient. Technically, you still have underlying kidney disease, but it's been remedied with the use of a graft, meaning another kidney. So consistency is super, super important, and that's something to work on actually, and to think about and work on while a patient may be waiting to get a kidney transplant. They're on dialysis. Work on that consistency. Work on perfecting your regimen, on your lifestyle, on following up with your providers, on the medications. If there's a problem, let's solve it. Be proactive about it. So I think those are very, very, very important. Nobody's perfect. The expectation is not that. Although I think sometimes maybe that's how people may receive the feedback or the expectations of a program, is that they can't make one single mistake, etc. The idea is that a mistake or an oversight is going to happen. The idea is use that communication, use that honesty, keep that line of communication open, and if there is a mistake or if there's an error or something happens, just be faithful in reporting it and bring it to the attention. That actually is going to result in a better long-term outcome. That's very, very important. And so the communication actually should be up there as well. I don't remember offhand if it is, but so the relationship is very important. Just like the social relationships that sometimes fall off when a person's not feeling well, sometimes the relationship with the providers can fall off when a patient's not feeling well or doing well. And it could be due to any number of factors, whether mental health illness or not. Family crisis, emergency, something happens. But it's very, very important to think about the consistency and the relationship and the strength of the relationship between a patient and a patient's family with the transplant program is very, very important, because that's what's going to carry you through the post-transplant phase, but also can carry you through the pre-transplant phase in terms of trying to problem solve issues. So the first thing is, I think that is actually for the patient to do what you did in your case, as you shared with us, and actually not suffer in silence, bring it to somebody's attention, a healthcare worker's attention. In this case, it was a social worker. It could be anybody. It could be a PCP, a nephrologist, any other type of physician. It could be anybody, and I think that's the very first step, is letting somebody know, say, look, you know what, I don't feel well, this is not me, or I'm getting feedback that I'm behaving in such a way and I don't even realize it, and so can you help me, what can you do? And so taking it from a bird's eye view, from a bird's eye mental health view, there's an entire department of psychology and psychiatry, for example, or it's Department of Psychiatry and Behavioral Sciences now at Rush, and so those individuals are available and they receive referrals. They could receive referrals from a social worker, a PCP, any other essentially healthcare provider, so that it's an opportunity to go and explore that in further detail and look at what's happening and see what's there. And then at that point, there's a discussion about what sort of treatments may be helpful. And usually it falls into one of three categories. Some people like to talk about things and get things kind of quote unquote off their chest. That's one option, so it's essentially a psychological talking-based therapy. Certain conditions are much better treated with medication. Some patients prefer not to talk, but they prefer to take medicines to help them deal with the condition that they have, or there's a combination of that. There's also outpatient programs that are designed to do this, such as intensive outpatient programs. And some patients actually need inpatient care, because they feel so awful and so terrible, they're going through something, that there's inpatient psychiatric care that may be necessary or needed. And so now that you're building this kind of network of providers who can communicate with you and amongst each other to work towards this common goal, to figure out what are the problems, what's happening, and move forward from there. And one last thing also is that it's important that we understand, like I said before, for example, there are a lot of medical conditions that have overlap or that can cause or masquerade as mental illnesses. And so that's why it's important, I think, also to get connected and see a psychiatrist. Ideally, if you can, either a med psych person who is an individual who's dual boarded in psychiatry and internal medicine, or what we call a consultation liaison psychiatrist whose expertise is in working with patients who have underlying medical problems, which may cause secondary mental health issues, or mental health issues which actually may worsen their other medical problems. That's an excellent question. Go ahead.
I think it would have been helpful if, when I left the hospital, they would have explained some of the medications that I was on. So I left with 22 pills, and one of them was prednisone, which I was just highly sensitive, emotional, and I was gaining weight. I looked different to me. I felt different. So I did end up seeing a social worker or a psychiatrist for a minute after my transplant, but it took a very long time to get to that point because no one really talked to me when I left about the medications and how some of them would make me feel or even transform. So I think it's very helpful to have those pieces in place when patients are leaving at discharge. And I know they really tried. And that's what they told me. We wanted to make sure you talked to somebody before you left, because I was on this high, like, oh, I have this transplant, life is gonna be great. And then I hit this low, and I was just like, I'm not crazy, but at the same time, I have hair everywhere, I'm gaining weight like crazy. So it took, I would honestly say, for me to feel like myself again, it took me a good 6 years, 6 or 7 years after my transplant to really feel like me. And by that time, I had already had a baby after my transplant, so I added more. So I'm sitting in this doctor's office, his psych, and he's like, well, we have this patient, she's had a baby, and she's crying all the time. I don't know what diagnosis to give her, and I'm like, I can hear you. So I just think it just needs a little bit more attention needs to be paid on the mental health of the patient. I haven't revisited the hospitals in a while to see what they're doing. Myself, I'm a master level clinician, but I work with children.
Okay.
They're easier to meet. But so again, there's so many pieces of it. When you leave and you have the medication, you have the transplant, and I appreciate you being here today. When I sat back down, I was like, oh, good, I need to hear this again. But those are my comments, though. But thank you.
And I think you're exactly correct. The situation all of a sudden becomes very, very complicated. You have the introduction of, I don't know if you were taking 22 or even more pills before, but you have a lot of medications, and steroids are well known, but not frequently, but they're well known to cause emotional or affective difficulties for some people. And so, unfortunately, we're not able to predict who. But you're right. I think there needs to be more discussion and perhaps more screening and routine follow-up so that these can be caught earlier, potential side effects, because there are, and not only just the steroids, certain post-transplant medications are also associated with alterations in thinking and feeling. And the person may think, oh, well, if it's subtle, the person may think, well, maybe I'm just going through something right now, or it may coincide with a stressor happening, and all of a sudden you have all these things happening. Life happens in the meantime with all this, and it can be very difficult to parse out. So I think your comment is an important one, and I think it motivates us to think about, well, in the post-transplant phase, how can we, continue to, or what things can we do to continue to make sure that dialogue stays open and screen people so that if they are going through something, that it's fairly easily detected. I think a lot of the emphasis is often about on the on the labs, on the medications, et cetera, and sometimes some things which may not be at the forefront at that time may linger for some length of time. 6 years is a long time, but I'm so glad that you're feeling better. Yes,
I was
ma'am.
of the understanding that there is a psychological assessment prior to going on a transplant waiting list. Am I mistaken in that?
So all patients will see a social worker, and during that interview, and I think the emphasis or focus may slightly vary from one center to another, but all patients will see a social worker, and during that time, there will be a discussion about how a person's been doing, have they been experiencing any difficulties with their psychological or emotional well-being. in our center, we tend to use some screening tests which help us identify things that may be there but not so obvious. I'm not sure if that answers your question. Yes?
I must say that even after transplant, that has helped me, that they're willing to open up still to me to this day and help me, guide me through now. I can't speak for other hospitals, but I can say at Loyola, as long as the patient is willing to be open and honest with them, they have worked with me so much. And I know that they've worked with my living donor as well. So I think going through before a transplant and after, it's very hard mentally, like you said, and I really feel the more honest that you can be, even though it hurts you inside to spit it out, the more the hospital's willing to work with you. And I'm just saying that because, you know, July 13th is just around the corner for me, and it'll be 2 years, and I still call them. So just wanted to put that out there.
So I think that's the idea. The idea is that a lot of people are very fiercely independent. Let's talk about that as well, right? I see a lot of people who, in their lives before they developed kidney problems or other health problems, fiercely independent, went about things, lived life on their own terms, etc., bull by the horns, if you want to use an expression, right? And it becomes much more difficult to do that. It becomes much more difficult to do that. It's very upsetting, and still they want to try to maintain that independence, and that's natural for a lot of people. It's natural for a lot of us. You know, we want to try and work through our problems first before going to somebody. I think part of that may also be cultural. But at some point it reaches a threshold where trying to do that just leads us to go around essentially chasing our own tails. And so if something doesn't feel right, if something doesn't feel good, no matter what it is, mental health related, physical, etc., it's always encourage you to speak up, or if you know somebody who's going through something or has kidney disease, etc., encourage them to speak up and don't give up. Oftentimes very good things can happen. And again, this life is not stopped while a person is on dialysis. They still have life, they're still living a life, right? So why not let's work together to make that the best quality of life it can be. There's a lot of problem solving to be done, but it can be done, and it can be done very effectively in partnering with your transplant program, with your healthcare providers, and having open, good, consistent communication. So I hope that in talking today, really, the idea is that the pre-transplant and adapting to life before transplant with kidney disease is very intimately associated with actually how a person will adapt and use the pre-existing behavioral patterns and adapting and coping strategies in the post-transplant phase. And so sometimes there's work to be done there. But actually working through those problems is a way to actually build that strength, build that repertoire of tools to adapt to problems and work through them. And that will also help in the post-transplant phase, because the post-transplant phase has a whole bunch of challenges in and of itself. It's not as if the journey comes to a complete end. But again, so structure, right? Have goals, work towards goals, regain some of that structure, regain the loss of social engagement if that happens. They're really, really critical. And of course, what we put into our bodies and exercise is also very, very important. All of us are, for lack of a better term, guilty in wanting instant gratification in what we do. And especially, and understandably so, even more so with our health. We want to be better today or yesterday, not tomorrow, not 5 months from now, etc. And I think that sometimes that can become an intense preoccupation for patients. And I understand that, but I also think that that can lead people to also not feeling well about their situation, not feeling well about themselves, judging themselves, getting caught up in the past. Maybe something happened in their past that led to their kidney disease, any sorts of things. But I think it's about taking things, looking at it as a journey, establishing goals while working towards that goal, and be careful about being too focused on that instant gratification, because that may also rob the person of other opportunities in which to grow and develop and actually have the best outcome that they can.
Doctor, did you speak to the managing the ups and downs dealing with the living donor process?
The living donor, so the the patient having to live with the ups and downs of what happens with
Yes,
the.
when someone says, I'll be your living donor, I'll get tested for you, and the ups and downs that go with that, with people either going through the process or not, getting tested and not being a match. You know, there's excitement when somebody says it to you.
Sure.
And then there's the absolute opposite when either the crickets chirp or you get a no.
The disappointments. Sometimes a crushing disappointment about when that falls through. That's a very challenging situation. It's something that easily can put somebody on a roller coaster of up and down. What are some ways in which a person can deal with that? I think that brings us again back to the idea that that we're on a journey and that we need to prepare ourselves for the bumps in that journey. And so I think sometimes it's easy to get very far ahead, and I think and it's understandable. Again, we start thinking about, this is the life that I've been waiting for, now I'm going to have this, and then we start spending a lot of our time thinking about that, focusing on that, but it's not something that we have in the here and now. And I think sometimes being grounded in the here and now can be very helpful in dealing with that and say, hey, look, this is good news, but today, here and now, this is what I have, and here's what I need to do in the here and now. And so being grounded in this here and now, while still maintaining that hope and working towards that, but being grounded and say, I'm still here, this is what I have to deal with now, I think can be helpful. I don't think that there is a solution or a panacea for that kind of disappointment, but I think the grounding can help quite a lot. And relying on the people that are closest to you and that you trust can be very, very helpful. But that is just a very difficult situation.
And I have another question about how would you suggest that people deal with having to go on disability after they've been gainfully employed for a long time and making that adjustment due to the fact that they have end-stage renal disease and have to go on dialysis? How do you suggest that people deal with that?
That's also a very challenging situation. I think that can hit at the core of people's identity and how they see themselves and how they've seen themselves over the course of their life. And if there's a family unit, that can also affect the entire family unit. And so some of the things that are important are to find ways to substitute the loss of the structure, the goals, the meaning. It needs to be taken by something else, whatever that may be. Maybe that's a new role within the family functioning of the family structure. Maybe that means volunteering one's time if they're well enough to do it, help other people who are ill, help other people who are not able to care for themselves or meet certain needs. I think that is so important, and I'm glad you asked that question, because I think that really can be very, very difficult, not just for the patient, but it affects a lot of families. And so I think people need to work on it in the context of their family. And how are we going to do things differently? What roles are they going to have where they still feel like they're making a meaningful, impactful contribution to their family, or if they want to help others, to society? And so I think that they need to find ways in which to do that. And of course, there's often financial challenges. Don't go through that alone either. That's a good time to liaise with a social worker, find out what are the resources that are available to you, not just the disability, but other programs, etc. Sometimes there's financial counselors that have a fiduciary duty. That's very important. A financial counselor with a fiduciary duty is a financial counselor that must, by law, oh, that was strong, that must, by law, act in your best interests. Okay? So again, it becomes in problem-solving mode. That's another thing I kind of recommend, is that when things start to get to be too much, you go into problem-solving mode. It's a problem that has to be solved, and try to keep it just plain and simple, and that's it. This is a problem, I'm going to solve it. It doesn't matter. We try to remove the emotional valence sometimes from what's happening, and this is a problem. I'm going to solve it. I'm going to work with whoever I can, and I'm going to solve this problem, and it's just a problem. And sometimes reducing it to that can reduce this sense of being flooded or from the tidal wave washing over us. Thanks everybody for your time and attention.
Thank you so much. This has been so informative. I'm so glad that we're videotaping this because everybody who wasn't in this room needs to hear this. You touched on so many important issues and topics that affect us all, and I thank you for being here. I appreciate it, and you're spot on with all of it. And none of it's easy, but one day at a time, we can all do it. We can all do it. And where you're at, I know where you're at. You'll get there. God has a plan for you. He didn't bring you this far to not let you not reveal his plan for you. So, thank you. Thank you so much.
Thank you.